Good day, ladies and gentlemen. I'm Stan Lapidus. I'm an inventor, engineer, entrepreneur. I've been involved in early cancer detection now since the mid-1980s. So I became involved in 1988 with the idea of automating the Pap smear by using machine vision. My background itself is in imaging science. And my team and I worked for a couple of years. We got better all the time, but never good enough. And really quite out of desperation, as the money was running low, I invented what became the ThinPrep Pap smear. So this is a better way of making a Pap slide, a Pap test. It puts cells in a single layer without overlying mucus and blood, making diagnosis easier and ultimately more accurate. The result of the Cytyc ThinPrep was that the milestones were invention in 1988, approval by the FDA in 1995, and in 2007 was successfully sold for over $6 billion to Hologic. For me, the greatest moments were in 2012 when the ThinPrep prototypes wound up, the two ThinPrep prototypes wound up at the Smithsonian Museum, and papers started to come out in that decade of showing a reduction in mortality attributable to ThinPrep, a profound reduction in mortality attributable to ThinPrep. The next company I founded, Exact Sciences, which makes the Cologuard test, was a spin-out from Cytyc. The idea arose from if we can look at cervical cells, what are other epidemiologically important cancers for which early detection makes a difference? Lung cancer is the most deadly, largely confined to smokers, and at the time, there was no evidence that early detection saves lives. Since then, that evidence has been developed. We focused on colorectal cancer. Colorectal cancer has a long pre-malignant phase called, as manifest in polyps and adenomatous polyps. Removing polyps is curative. It prevents the patient from being diagnosed with cancer. So cervical cancer has its dysplastic stages. Colorectal cancer has polyps. Esophageal cancer has Barrett's esophagus, a precancerous condition that exists for a long time before full-blown cancer develops. So the modern paradigm of cancer, which begins with Papa Nicolau almost 100 years ago, is find pre-malignant lesions, you prevent cancer. Early detection saves lives. While Papa Nicolau focused on cervical cancer, we've seen in prostate cancer, we've seen in colorectal cancer, we've seen in breast cancer that early detection does save lives, and that if cancer is itself full-blown, if it's early stage, the outcomes are better. Alas, that's not so true in esophageal cancer, but our focus is therefore on Barrett's esophagus. I was introduced to what became Lucid in 2018 by Sandy Markowitz, who was one of the scientific founders of the company. He mentioned to me that he and his colleagues had just published a paper on detection of Barrett's esophagus. The work consisted of a collection device, a novel collection device, and a novel assay. Lishan reached out to me as the work progressed in 2020, and I was very excited from the get-go. To me, the parallels between cervical, colorectal, and esophageal cancer were very clear. This is a cancer especially for which early detection saves lives. There are guidelines for screening high-risk individuals with esophageal cancer. Those guidelines are largely ignored. The results are tragic. Shortly after meeting Lishan, I did the test myself at a lab at the company's facility in Phoenix, and it really did go down very easily. It was easy to swallow. One doesn't feel anything on the way up, and the test was over very quickly. I'm excited about the company because of its potential for reducing mortality from esophageal cancer by finding pre-malignant lesions. My mantra, my professional mantra, has always been focus on problems that are big, large markets, that are clinically important, and for which the company has IP that is broad and defensible. That really, Lishan and I bonded over those concepts. So let me talk a little bit about parallels that I see between Cytyc, Exact, and Lucid. Each company is focused on detecting premalignant lesions. That's the best place to intervene, to prevent cancer, to enable therapies that are curative. But curative therapies can only be applied if early detection has taken place. One of the things that's true about all companies in the early detection business is that it takes time to invent a test, to analytically validate a test, to prove out the test performance in the intended use population in clinical trials, and to establish utility, which means do doctors behave differently or are there better outcomes? In this sense, Lucid is just like Cytyc and Exact. The road is long, but the benefits are great. I'd like to spend a moment talking about liquid biopsies, and in full disclosure, I'm chairman of a company called Mercy Bioanalytics, which is a liquid biopsy company. But I think the greatest potential for liquid biopsies may be in detecting early cancers, not precancers, because when premalignant lesions are small, their connection to the circulation is very tenuous. Results to date have been not good for stages 1 and 2 and quite dismal for premalignant lesions. Direct sampling, whether it's sampling the cervix through a brush, whether it's collecting a stool sample to sample the colon, or whether it's using the little device that Lucid has, are direct methods that certainly show strong results for premalignant lesions. Whether blood will ever achieve that is unknowable, but I am confident it won't be anytime soon. I'd like to talk for a moment about the things that, in my mind, make Lucid unique. First of all, as we discussed, its technology, its collection device is in intimate contact with the affected area. That's super important for detecting premalignant lesions. Beyond that, speaking as a board member, the culture of the company is very mission-driven. The literacy broadly in the company about cancer, about molecular methods for detection of cancer, about the epidemiology of cancer, are widely known. Team is incredibly hardworking and are men and women whom I simply admire. Lucid's value proposition is very clear. It's early detection saves lives, finding pre-malignant tissue before invasion takes place is the difference between life and death.